Good afternoon, it's Jennifer Shepherd with the Shepherd Center for Integrative Health here on the west side of Cleveland, Ohio. And Happy New Year, it's great to see you, and I always have so much to share with you, just so much information and education for you all to just be well and live well and learn more about your bodies. So I wanted to start with just very briefly here in the Midwest. It's very gray. The sky is heavy, the atmosphere is heavy, and I know me personally, after 13, 14 weeks of gray, I really start to struggle neurotransmitter wise. So I'm bumping up the vitamin D for sure, working on exercise, keeping endorphins going, but I just reordered a new, we call it the Happy Light. So I highly, highly recommend them. If you are struggling through these midwinter blues, especially in the Midwest, having this little light is fantastic. I put it in my kitchen and turn it on as I'm cooking. I'll put it by my office, and I actually wish it was battery operated so that I could carry it wherever I go. So I'll put a link down in the comments, and if you have questions on light and light therapy, it's a wonderful thing. Feel free to reach out and we can talk about that. But what I wanted to dive in today is a patient I had this morning, and we really explored pressure systems. So I wanted to teach you and help you understand a little bit more about pressure systems throughout our body, how they become disrupted, what symptoms and I don't want to say disease, but what comes out of when pressure systems are disrupted, and then what we can do with our hands mechanically, manual therapy wise, to help you overcome whatever it is you're working with. So with this patient, she came to me with GI pain. So just underneath the diaphragm, just some general pain after some abdominal surgeries. So again, just concern of what else is going on. The doctor's not quite sure what to do with her. Here, just take some medication. And that wasn't the route that she wanted to take because again, it just didn't really give her answers or understanding as to why she was having the pain. So as we start diving into systems, a handful of things. So there's residual scar tissue from surgery that we need to work on in the organs. A big piece that really showed up today for her were pressure systems. So in the head, and the chest and in the pelvis, they're all cavities within the body that need to be balanced in pressure. So when I have patients who come to me and, when the atmosphere pressure changes, that's when I have more symptoms. That is a big key for me that, wow, pressure systems are off in the body, so the body can't quite tolerate or deal with the changes in the atmospheric pressure. So for this patient, it wasn't her primary, but she'd also mentioned, hey, I get headaches when the temperature changes. So again, there's my little, let's explore pressure systems. So as we go further into, here's negative pressure at the chest, and then we have the positive pressure in the abdomen. And then right in between, we have the diaphragm, and I'm gonna pull out pictures. After I work with every single one of you, after you're on my table, I dive into my books and we go back into the anatomy to look at what were the structures we worked on, the structures we addressed, and the relationships between. So, to give you a brief little picture from the side, okay, so here's your chest, side view, here's your abdomen, bottom view, and then the diaphragm. So it's a very, very important structure for your breathing. And when pressure systems are off, so we've got negative pressure above, positive pressure below, and if there's been any surgery down below to the abdomen, it will change the pressure. Same thing above. If there's been an injury to the lungs or bronchitis or pneumonia, I'll dive into those pieces. Again, the pressure system's gonna be off. So when pressure is not balanced through here, there are many, many, many very important structures that are coming through the diaphragm. Again, if there's too much negative pressure, it's going to pull the structures up and it's going to change the tension and change the function of those structures. So particularly in here, we've got the esophagus. So I'm going to talk about reflux here in just a little bit. We've got very, very important vessels, your aorta and your inferior vena cava. We also have lymph drainage. And then we also have the nervous system, the vagus nerve. So much of our work today was at the diaphragm and back to so much tightness, so much pressure. But then I had to go a little further back to how can I balance these pressure systems? So we went into the lungs. Again, history of being around secondhand smoke, bronchitis, pneumonia, it changes the ability for the lungs to have adequate pressure. So with our hands, we were able to feel and start to restore the viscosity and the healthy movement and balance of the lungs. Our next session, we'll dive a little bit further into the peritoneum, into the abdomen. But it's very, very interesting, again, as we balance that out and work through the diaphragm, the patient over the past couple sessions, she's been experiencing less reflux. She had complaints of reflux. So again, as we worked on the pressure systems and at the diaphragm, able to take tension off the esophagus so that all of those structures could work well. We also dove into the vagus nerve. So as far as the vagus nerve, that's your rest and digest. And especially, it's super important right now in our sympathetic world. So where we are now, so much stress and fight or flight going on around us. So again, if that vagus nerve, if there's not appropriate tension, if there's too much tension one direction or another, that vagus nerve is not going to be able to help you come into states of relaxation better. So reflux, parasympathetic balance, all of that parasympathetic affects sleep and stress levels, going into biochemical, hormonal pieces as well. So again, back to the importance of balance above and below, balance of the structures that go through. So those were the big pieces that I just wanted to introduce to you. So again, in typical medicine, right? You have reflux, take Prilosec, right? Again, it's not quite addressing what's going on mechanically. Why is this happening in the first place? So it's an exciting area for us to come in with our hands to explore and look at structures mechanically, because there are almost always mechanical reasons that drive a lot of the symptoms we have. And Prilosec alone, again, we know that it's not a great thing for stomach, acid balance and such. So it actually becomes a problem down the road the longer you take it. So we can address those things through manual therapy and also tweaking some of the things that you're eating in your diet. Vagus nerve is the big one. And then vascularity, we always want to make sure that vascular is clear, because we need healthy blood flow. So if you are struggling with nervous system balance, perhaps reflux, abdominal pain that doctors and practitioners aren't quite able to figure out what it is. We don't quite know. There's no reason behind it. Take a pill, or just even worse, just deal with that. There's a lot we can do to explore. Look at the big picture of your body, look at pressure systems, look at the relationship of structures, and then look at your history. Look at how has each thing throughout your lifetime impacted and changed the structure of your organs, tissues, joints, and then your body has had to accommodate over time. So it is very, very, very exciting work in integrative manual therapy. There are many of us who we work with each other, we continue to share, and the most important thing for us is to educate all of you and then educate your providers as well, because there are so many people who continue to seek and search for just feeling better and feeling healthy and wanting a better quality of life with their bodies and their health. So when you feel better, everything is so much better. That is all I have for today. So yes, I am here on the west side of Cleveland, and I do treat out-of-town patients. We do intensives over 2 and 3 days. I do have patients do consult calls prior to coming in to discuss needs and expectations and what the work looks like for out-of-town patients. If you are here in town, I still do consult calls, so we talk about what you have going on before we schedule visits. I am scheduling into the end of February, so I do have availability end of February, and I look forward to helping you restore your body and just help you meet your goals, help you live the life that you want to live, and help guide you there through all your health concerns and needs. Thank you so much, and I'll see you soon.